Hello class, this is a brief video presentation on the readings that we just had on health literacy. I will talk a little bit about minority health, and this will be the information you'll use to develop your library guide, which is the third phase of this module. You should have received an email inviting you to create a login. I created a group in the platform and it is under my name, Searles A. Nunez. I also created a template for a health literacy LibGuide that's what you'll do, is create one for either the Hispanic community or the Native American community. So let's go ahead and get started. So from the readings, we understand that health literacy is the ability to obtain, process, and understand basic health information and services needed to make appropriate decisions related to health. The inability puts the individual at risk for poorer access to health care and negatively impacts their health outcomes. So in the U.S., approximately 80% of Americans have limited health literacy. So what's at play here? People with lower health literacy tend to use emergency care services more and are found to have increased hospitalizations. They underutilize preventative services such as getting vaccinated or having regular screenings. When medication is not taken appropriately, it increases their risk for an adverse medical event. This is associated with the inability to read labels and interpret the information on how the medication should be taken. Literacy in Hispanics. In the Hispanic community, contributing factors include English language proficiency, healthcare system, and healthcare provider cultural competency. Residency status may impact access to care, ranging from emergency room or emergency department care versus regular care. Also, the level of acculturation may factor into information comprehension, as well as their ability to seek, access, evaluate, and use reliable health information. And it's important to point out here that there are gaps in information that addresses the variances of information needs in the Hispanic subpopulations. The Hispanics are not a homogeneous group. Health beliefs and health values are very different among the Hispanic subgroups. The literature suggests that health literacy in the Hispanic community may enhance health outcomes if Hispanics better understand the health issues that are prevalent in their own community, such as diabetes information, what obesity is. So one way to address health literacy in a culturally and linguistically appropriate manner. Now this is done in health promotion, health education, and very much within the public health arena. As within the Hispanic community, there are language barriers that contribute to the level of health literacy in the American Indian community. Information can easily be miscommunicated, lacking the appropriate cultural context, particularly when it is literally translated from information written in English. In Native communities, there is an increase of risk of hospitalizations due to the lack of understanding of the disease process and prevention measures for optimal health outcomes. We also see that in the Hispanic community. Poverty is an extraordinary contributing factor in tribal communities, and this directly impacts health literacy levels. A primary focus of the Indian Health Services is to increase health literacy to address chronic disease, behavioral health, and expand health promotion, disease prevention initiatives. This must be done within a culturally and linguistically appropriate framework, and communication is key, principally within the patient-physician or healthcare provider exchange. Health literacy improvements must not only be directed at the patient from a cultural community, but must be addressed with healthcare professionals and the healthcare system as well. On your own, take a look at these websites. So what you want to do is Google NNLM evaluated websites, and you'll find the nnlm.gov list of information on how to evaluate websites. And then there's a brief tutorial that's available on Medline Plus that's made from the National Library of Medicine, and it's entitled Evaluating Internet Health Information. So take a look at those two resources as well. Let's take a look at minority health. Health literacy improvements must not only be directed at the patient from a cultural community, but must be addressed with healthcare professionals and the healthcare system as well. A survey conducted in 2012 found that 72% of internet users say they looked online for health information within the past year. 77% said they began their last session at a search engine like Google, Bing, or Yahoo. 13% said they use a specialized website like WebMD. And 1 to 2% said they started their search at general sites like Wikipedia or Facebook. And 52% of smartphone users say they have used their phone to look up health information. In 2013, according to the Pew Research Center, 35% of the U.S. adults said that at one time or another they have gone online to try to find out what medical condition they or someone they know might have. There is a high likelihood that many of those searching online for health information include younger people, white adults who live in households earning $75,000 or more, and with a college degree or advanced degrees. Women over men are more likely to go online to figure out a possible diagnosis as well. According to a 2008 report from the Pew Research Center, Hispanic Trends, it was known that most Latinos or Hispanics received information about health care either from the media or from their families, friends, churches, or community groups. And when it was examined back in 2008, it was reported that 83% of Hispanics obtained health information about health and health care from television, radio, newspapers, magazines, or the internet. And back then, 70% reported obtaining information from family and friends, or churches and community groups. For U.S. Hispanics, computers and internet access has increased substantially since 2008. And as I previously mentioned, it has been documented that the smartphone is highly used among Hispanics, particularly the younger ones. In a study published in 2012, a community advisory committee gathered information from several studies that were conducted with representatives from several tribal communities at events in the Central Plains region. It was found that for the most part, physicians are primary sources of information because they are a trusted source. What they found in this report was that typically health promotion campaigns are a method used to distribute information. The information or messaging is tailored to the audience with the appropriate components included, such as literacy levels and cultural content. Although information seeking in the virtual or online environment is increasing, most of the respondents in this study, highly representative natives living in the Midwest, said that they use media sources like books, newspapers, and magazines, and the provider of said information came from Indian Health Services. Although information seeking in the virtual or online environment is increasing, most of the respondents in this study, highly representative natives living in the Midwest, said that they use media sources like books, newspapers, and magazines, and the providers of said information came from Indian Health Services, the health providers such as the pharmacist, physician, and tribal clinic health care provider. The internet is underutilized, and it is suggested that it may be how the information is presented, in readability or in context, such as social or cultural information, or how it is presented graphically, such as words over pictorial cultural symbolism, and how it is accessed by the user seeking the information. So, bridging the gap. As the information environment constantly evolves, it is important to stay aware of the issues that contribute to low health literacy and find ways to reduce its effect on the patient and consumer. This is especially true for policymakers, healthcare professionals, and stakeholders. And the health information professional should play a significant role in that process.